Welcome everyone to this MCQ session where we are discussing the recall questions of FMGE exam 2022. There were 9 questions in total from forensic medicine. Let's discuss these questions one by one. So our first question is, during examination in injury, hair bulbs are noted to be damaged and crushed. The probable type of wound is. Now, one important information that is given in this question is that hair bulbs are crushed. If we see a hair bulb injury, and if the weapon which has been used to deliver the injury on the part of the body where hair are is a sharp cutting weapon, then hair bulbs will be cut. Hair bulbs will be cut. But if the weapon which has been used to deliver the injury on the body is a blunt weapon, the hair bulb will be crushed. Okay. So basically, if the question is saying that hair bulbs are crushed, then we know that the injury that has been delivered to that part of the body is an injury which has been delivered by blunt force impact or blunt weapons. Okay. Now, if we look at our options, there are 4 injuries given: abrasion, laceration, stab injury, and incision. So, stab injury automatically goes out because it's an injury that happens with a pointed weapon, or you can say pointed sharp weapon. Incision also goes out because it is again delivered by a sharp weapon. Abrasions and lacerations are 2 options which can be possible. Now, abrasions are superficial injuries to epidermis which are produced by a blunt force impacting the body. Lacerations are the injury which are produced by a blow given at the area of a body where the skin ruptures. Okay, and if we see that air bulbs are crushed, then a blow to that area should have been given. The important thing to remember is blow to the area of body. A heavy blow is given at the area of the body. That is why the skin might have been lacerated and the adjoining hair bulbs got crushed due to that blow. So correct answer in this case is option number B, that is laceration. Okay. Remember, if the area of the skin would have been cut, then probably the hair bulbs would have shown a clear cut appearance, not a crushed appearance. Next question. Question number 2. A patient with history of cobra bite presents with drooping of eyelids, respiratory difficulty, and difficulty in swallowing. So what do we see? We have drooping of eyelids, respiratory difficulty, and difficulty in swallowing. All these are signs of neuroparalysis generating in the patient, okay, which is obviously one symptom that is expected to be observed in cobra bite, because in cobra bite the primary toxin is neurotoxin. The primary venom is neurovenom. 10 vials of antivenom already have been administered. ICU not available. What is the next best thing to be done? 10 vials of antivenom that has been administered shows that probably the clinical person is expecting it to be a moderately kind of venom infusion, okay, and because neuroparalytic signs are present, we need to give some drug to counteract the action of that neuroparalytic enzyme or neuroparalytic situation, and the obvious choice is option number B, atropine plus neostigmine. Okay, if you look at a basic idea of cobra bite treatment, if the symptoms are minimal, that is, the patient has an infectious bite but symptoms are minimal, he is presented with minimal symptoms, the anti-snake venom, polyvalent anti-snake venom, 5 vials of it should be given as an infusion in saline. If the symptoms are moderate, 10 vials of anti-snake venom should be given. If the symptoms are severe, we can give up to 15 vials of polyvalent anti-snake venom. Okay, for counteracting the neuroparalysis, what do? We give 1.5 milligram of neostigmine plus 0.6 milligram of atropine. The atropine is added to counteract the muscarinic effect of neostigmine. We need to counteract the secretory effect of neostigmine itself, okay, because otherwise it itself will start producing complications. So you give a combination of neostigmine and atropine. If the person responds to it, you repeat this combination after 10 minutes and thereafter half hourly till the person is asymptomatic. Okay, so remember, in cobra bites, contrary to viper bites, because vipers are primarily hemotoxic category or family of snakes. Cobra bites, crate bites, cobra and crate are two important snakes which are belonging to the family of neurotoxic snakes. Along with polyvalent anti-snake venom, we need to take care of the neuroparalytic situation also, and thus giving neostigmine is a obvious options in these cases. Okay, let's move to question number 3. A patient with history of substance abuse has brought to casualty. The patient has respiratory rate of 8 respirations per minute, pulse rate of 52, blood pressure is 90/60. So if we see these 3 vital parameters which have been given in the question, what do we see? That the person has low respiration, low blood pressure and low pulse. So respiration has gone down, blood pressure has gone down, pulse has gone down, and on top of it, they say that pinpoint pupils are noted. Okay, very very important kind of a clincher that has been given in the question. Okay, what is the poisoning? Now it's a very very simple situation. Whenever you encounter low respiratory rate, low blood pressure, low pulse, it is a situation of cerebral depression. That's why we have low respiratory rate. Okay, this coupled with presentation of pinpoint pupil, the automatic choice is morphine or opioid poisoning. In cocaine poisoning, these parameters are elevated. So in cocaine we have respiratory rate high, blood pressure high, pulse rate high, and cocaine poisoning generally present with myocardial infarction like symptoms. So there could be a history of chest pain or ghuttan, difficulty in breathing with kind of symptoms with high perspiration. That is cocaine with dilated pupils. Okay. So it's not a very difficult kind of poisoning to answer. I hope all those students would have gone through these common poisons with morphine, cocaine, ganja, alcohol. It would have been very easy for them to answer this question. The correct answer here is option number A, morphine poisoning. If somebody asks you about treatment is simple because antidote is available in morphine poisoning. The antidote is naloxone. Okay. Let's see the next question. Question number 4. Opinion of 2 doctors are needed for medical termination of pregnancy when the duration of the pregnancy is. The correct answer is 20 to 24 weeks. Now, this answer is appropriate as per amended MTP Act 2021. What does the amendment say? Up till 20 weeks of gestation, one doctor can decide and perform the MTP procedure and (20 to 24 weeks of gestation). 2 doctors decide and one out of them can perform. So this is as it stands now. In old MTP Act 1975, the upper limit till which the termination of pregnancy could have been done was 20 weeks, and that act said that up to 12 weeks one doctor can decide the procedure and can do it, and 12 to 20 weeks 2 doctors are needed to make a consensus of what procedure has to be done, and one can do it. Now the upper limit of performing MTP has been increased from 20 weeks to 24 weeks, where up to 20 weeks one doctor can decide and do, and 20 to 24 weeks the consensus of 2 doctors are needed to decide what procedure is appropriate for a particular patient. Although one of them can go ahead and conduct the procedure. Okay, so that's one important amendment that we need to remember around amended MTP Act. Okay. Okay, question number 5. Lead poisoning, the concentration in the blood is 60 micrograms per deciliter. This is called as BLL or blood lead level. Blood lead level is 60 micrograms per deciliter. The treatment is, the correct answer of the treatment is option number A, that is EDTA. Okay, what is the scheme of treatment of lead poisoning depending upon lead levels in the blood? If the poisoning is mild, the blood lead level is 20 to 35 micrograms per deciliter. The treatment is D-penicillamine. The chelating agent of choice is D-penicillamine in mild poisoning. The lead levels are 20 to 35 micrograms per deciliter. Moderate poisoning, the blood lead levels are 45 to 75 micrograms per deciliter as it was given in our question. The chelating agent of choice is EDTA. Okay. Severe poisoning, when the blood lead level is greater than 75 micrograms per deciliter, the chelating agent of choice is BAL plus EDTA, British anti-leukocyte plus EDTA. So depending upon what is the blood lead level, the chelating agent of the choice may vary. Blood lead level is 20 to 35, that is less than 35. The chelating agent of choice is penicillamine. Blood lead level is 45 to 75, that is moderate kind of poisoning, which was actually asked in the examination. The chelating agent that we use is EDTA. And in severe poisoning, where the blood lead levels are more than 75 micrograms per deciliter of blood, we use a combination of EDTA and British anti-leukocyte. And once the blood lead level comes below 40 micrograms per deciliter, in severe poisoning, we stop British anti-leukocyte and we continue with EDTA. So what you need to remember is, in this situation, once blood lead level falls below 40 micrograms per deciliter, British anti-leukocyte is discontinued and EDTA alone is continued. Okay. So correct answer in this question was EDTA. Question number 6. Leading questions are permitted in very classical question, have been continuously asked in recent times in NEETPG examinations also, in INICET examinations also, for postgraduate entrance examinations, and it has been asked in FMGE examination also, because it's an important situation to understand. Okay. Now what exactly are leading questions and where exactly they are asked? Leading questions are asked in the court of law to a witness. When a witness goes to give evidence in a court of law, okay, and leading questions are asked by lawyer of opposite side during cross-examination. So correct answer in this case is option number B, cross-examination. See, what happens when a witness goes to the court of law for giving evidence is that when the witness comes to the courtroom, the first thing that happens with the witness is examination in chief, also called as direct examination. Examination in chief or direct examination is conducted by the lawyer of same side. So consider if the witness belongs to prosecution, the prosecution lawyer will conduct the examination in chief. Okay. What happens in examination in chief? Simply, whatever witness knows about the case, he tells the court for the first time after his arrival in the court of law, because examination in chief is the first thing that happens with him. Once the witness is finished telling whatever he knows about the case, the examination in chief finishes. Now the witness is available to the lawyer of the opposite side, that is defense, if he wishes to ask any question to the witness. This is called as cross examination. Now in cross examination, the defense lawyer has the opportunity to ask leading questions to the witnesses. What are leading questions? Leading questions are such for which the witnesses have to answer yes or no. So these leading questions, they are not permitted in examination in chief. Remember, leading questions cannot be asked when examination in chief or direct examination is going on, but they can be asked when cross examination is being conducted by the lawyer of the opposite side. Okay. What happens in re-examination, which is another option given here? Re-examination happens after cross-examination if needed. Okay. And in re-examination, again, the lawyer and the witness of same side are talking, because re-examination again will be conducted by the prosecution lawyer. So whenever lawyer and witness of same side are talking, leading questions are not supposed to be asked unless and until it is a scenario of hostile witness. Okay. So what do we understand in this question is leading questions, they are not allowed. Number one, during examination in chief, also called as direct examination, and they are also not allowed at re-examination in chief, also called as redirect examination. Okay, but leading questions are allowed. Number one, in cross examination, and number two, during examination in chief if the witness turns hostile. So they can be asked in examination in chief, but only when the witness turns hostile. So according to the question that was available to us in the examination, the best answer was cross examination. Okay. Okay, question number 7. Getting sexual gratification by giving pain to partner is known as. This is a very standard straightforward question. The correct answer is sadism. Sadism is a scenario of sexual perversion where the person gets sexual gratification by giving pain to the partner. And when the person gets sexual gratification by receiving pain from the partner, it is called as masochism, given as option number A. Okay. So that's a very straightforward question. Let's move ahead on question number 8. Features of artificial bruise is. What is an artificial bruise? First of all, let's see that. An artificial bruise is a bruise which is drawn by a person on his body. So it's not an antemortem injury. He has not suffered any injury. He has just discolored an area of the body so that that discoloration looks reddish blue in color, so that he can go to the police and complain that somebody has provided him hurt. That's an artificial bruise. Now, artificial bruise, as it is just a discoloration using certain organic products to make them real. It's basically a foreign compound being applied onto the body. For its production, classically, two substances have been used. These are juice of calotropis and semicarpus anacardium. Okay, so when these substances are going to be applied onto the skin, as they are foreign irritant substances, there are high chances of itching, irritation and some anaphylactic reaction happening locally in that area, which can lead to development of vesicles. Okay, extravasation will not be seen because extravasation is a property of antemortem original bruise. That's the bruise where after sustaining injury by the subcutaneous vessel, the blood extravasates in the subcutaneous tissue. Okay, color changes, obviously color changes are properties of original bruise. Okay, erythematocyte, it is also a vital reaction which will be generated only if the body has suffered an antemortem injury. So what is the feature which goes in favor of an artificial bruise is vesicular development due to irritant reaction on the skin. Let's take up the last question, and the question is, among the following, which has the highest affinity for hemoglobin? It's basic physiology, and the correct answer here is carbon monoxide. And the reason is the carbon monoxide molecule attaches itself at right angle to hemoglobin plane. Okay, so consider if the plane of hemoglobin is like this, then the attachment of carbon monoxide molecule is like this. This creates a very stable steric compound. So this compound is very, very stable, and thus the molecule is very stable. So the affinity for hemoglobin to carbon monoxide is very, very high. Okay, that takes care of the discussion of our 9 questions. Hopefully the discussion would help you in solving correct answers, and best of luck, best wishes for all of you who have given this exam this year. Hopefully I'll soon see you preparing for your PG examinations. Okay, then we'll talk about the subject in detail and a lot more concepts around it. Okay, bye for now, take care, bye bye.